So what do you consider then are the barriers to the adoption of such a digital transformation in this market?
I think internally, the biggest barrier is really a lack of leadership. The NHS, because it is the sacred cow, if you like, no political party has really shown the strength to say we have got to change the way the NHS operates. We have got to run it as a business. And it's one of the reasons why the efficiencies don't come through. And I'm not trying to make a political statement. This is just a fact. And there are many papers that have been written about this. The more important aspect that comes out of this is that lack of leadership is a lack of business leadership. So there are many, many very high quality, highly capable managers within the NHS, but they haven't got the commercial background. So against that is, if you like, a short-termism. We're all aware that there's a financial need within the NHS, and it's true, the NHS does need money. It needs money in two ways. It needs money to operate, but it needs money to change. You know, you can't transform a business significantly unless you invest money, and unfortunately that money isn't there.
And so what are some of the latest key initiatives being taken by NHS England and other governmental health bodies to accelerate the adoption of digital technologies?
Sure. Well, I mentioned Scan for Safety, that's one, and that's a quite significant area for anybody that is involved in sort of back office systems and certainly in the supply management chain. But it has a wider appeal because the uses of barcoding will lead to patient areas as well. That's one aspect. I think the second most important thing is that last year the NHS England brought in the digital doctor from the States, Robert Wachter, and he looked at electronic health records and produced a report which basically said that, you know, the UK, but particularly NHS England, was way down on the list of health organisations in the use of electronic health records. So the NHS England has put in place an exemplar programme initially targeted on acute trusts, hospitals, but that's been now extended to community services, to mental health, and most recently to ambulance services. So whilst it identifies, it's given momentum, first of all, to that whole arena, and it will drag those organisations into the adoption of electronic health records. But the more important thing is that from a market point of view, it's effectively saying these are the leaders, okay, and all the rest have got to sign up to any one of those to follow. So if I'm an acute trust and I'm one of the exemplar sites, then another trust can come to me and say, I want to follow your route, okay? And that means they will follow that same supplier. So in some senses, okay, the market is being locked, okay, to existing suppliers in those arenas.
And as follow-on, which do you consider the top 2 or 3 technology areas that will drive the greatest ROI for the healthcare sector, while at the same time enhancing healthcare itself?
There's no doubt that focusing on patients has got to be the key. You know, I think there's been too much in the past that's focused on back office administration and so forth. So the movement towards AI and the adoption of AI and genomics, okay, separately and in combination, I think has huge potential benefit. And you know, our government has said that they want the UK to be the leader in AI. Now, we'll see what they will do to enhance that. Yeah. But that's one key area.
As I understand, you're also on the board of 1 or 2 other healthcare software companies here in the UK. And these two questions are somewhat connected here to end this segment. What do you see are some of the issues that such solution providers are grappling with? And then more importantly, what advice would you give to healthcare software companies to leverage the value of their offering and more effectively impact this market?
I think it's, in relative terms, it's fairly early days. There's no doubt that the cloud is being adopted by various parts of the NHS. But part of that adoption is, if you like, constrained by the fact that there are a huge number of legacy systems. So the adoption of cloud comes with a transition into new systems and to new opportunities. So some of those areas are population health management. They're the larger data areas where cloud lends itself to the setting up of data sharing across a community of healthcare. And I think that's where you'll see the drive coming. Then what you'll see, I think, is that as the exemplar programs move forward, then increasingly some of those newer technologies will be cloud-based. And there's another opportunity out there. Well, there's two opportunities, I think. The first is that even though a acute trust may adopt an electronic health record, that's the main system. But most hospitals have got hundreds of what are very often referred to as feral systems. And feral systems are those that have been written by individual clinicians because their existing mainframe systems don't give them what they want. Now, I think there are suppliers out there in the market who are looking at that saying, we can provide a platform that will allow those feral systems to be gradually removed into a more cohesive standard that's cloud-based.